Hi, this is Dr. Connie. I've lived with lupus for the last 19 years, and I belong to a Facebook page called Lupus Rebel, and I get asked a ton of questions. So after a while, I started to kind of document it, and so I think these are real life questions that you guys have. So I'm going to go ahead and ask the question and then attempt to answer them, and so hopefully that'll be helpful because some of them kind of appear over and over again, and I think they're very important to be addressed. So number one is, what does your butterfly rash feel like? Is it bumpy, burning, itchy, or tingly? Well, butterfly rash was I guess termed butterfly because it makes that butterfly-like pattern on your face. I typically get it when I wash my face at night, on those days where there might be some more inflammation than other days. It sort of like appears right after I wash my face in the morning or at night sometimes. It's flat, but it can be a little bit bumpy. I've seen it all. Some of my patients have what's called discoid lesions on their face, and it can be a little bit scarry. But I do remember when I was first diagnosed with it, it was flat, but it was very wide and circular. So it can come in any form. And usually it can be coupled with some more rashes near and around the joints. It's enough to freak you out initially, and I wouldn't go as far as to go to the dermatologist because they'll do a biopsy and they'll tell you it's multiforme. Erythema multiforme is a typical name given to this type of rash because obviously it's not cancerous, it's just an inflammatory response. So I hope that helps. And to kind of relieve it, you can visit my lupusrebel.com, and I have all kinds of strategies from oat cold packs to aloe vera and cucumber presses that's been very effective for myself as well as my patients. Second question is, does anyone get sores inside their nose and that won't go away? Well, a lot of the sores that we get, like whether it be inside our mouth, like canker sores or any types of sores, usually happens when your immune system is a little lacking. So it's a good idea to supplement. I'm a big supplementer because there's a gap. We all assume that with lupus patients, we do have some level of leaky gut. And so there is some nutrient deficiency going on, and plus the medications that we're on, it tends to degrade our gut lining a little bit further, and those medications compete for receptor sites into our cells. So it does cause some depletion in the nutrients. Particularly vitamin C is a good antioxidative supplement to kind of supplement. Emergency is what comes to mind. I also take a supplement form of powerful vitamin C because I know what I need. So I don't really have issues with the sores anymore. But anytime you have an open sore, that's a clear indication of more of an internal issue, usually stemming in the gut. And that's more comes from the Eastern philosophy. So vitamin C is a good option, and just try to do an overall supplementation. If you need help with that, we also have information on the supplements that I recommend on our site, lupusrebel.com. The third question today is, my not so wonderful husband told me I live in a fantasy world with all my problems like I'm faking it all. And I don't want to seem like I'm lazy, and I'm on so many meds every day, I'm not lying. And so this is really a very, she seems very emotional in this little text. But a lot of the times, I think we tend to like dramatize the problems. But what I will say is, I think with lupus, it does have, it does make you a little bit more susceptible to emotional appeals, like emotional, I guess, swings up and down, you'll have more of ups and downs, and the downs will come really hard. And that's to do with, again, neurotransmitter imbalances, and not very efficient metabolic processes to drive, because what's in our gut is gut as the second brain. It feeds our brain. So the mental loop, all the neurotransmitters that's necessary, we get from our gut, like to fuel our brain, right? So this is a very difficult concept for me to just kind of explain to you, but believe me when I say take a good probiotic, maybe supplement with magnesium, and just kind of start there and clean up your diet a little bit. That'll help you with the mood swings. Also to do with foggy brain as well. So anyway, we'll come back to that, as I think I have more questions on that. So with losing memory, words not coming out right, and being unable to speak sometimes, has anyone had brain scan done? I have MRI rescheduled for Wednesdays. This person's question. So on to that idea of foggy brain. I had this issue a lot, and I don't know if I attributed it more to postpartum and just being busy all the time. I certainly have that even now, but that's one of those things that I do not want to lose, because I feel like I have so many information that I carry in my cognitive space that that's the last thing I want to let go of. But certainly there were times in my life with lupus where I couldn't remember people's names, especially during the flares, because that gets in the way of, again, the metabolic processes and the neurons or neurological functions that sort of kind of add into that. Without going into too much biochemical details, it kind of plays together. And again, the whole anxiety and depression and all that spectrum of mental and cognitive issues certainly play a role with us lupus patients, and that's because all systems get affected ultimately due to our autoimmune activity in our bodies, unfortunately. But there's hope. And again, I became a very big advocate of supplementation for this reason. I didn't believe it initially, but until I tried it and I noticed a drastic improvement in not only having a little bit more clarity in my thinking, but also my gut issues started to disappear, and they're a lot more manageable in the things that I'm able to handle as far as what I take in, like in the way of foods. And then also like my hair and my skin has improved drastically, and I don't get sick very often. And my counterparts who are supposed to be healthy without any disease, they get sick around me all day long, so all the time. So anyway, so I hope that helps. I'm going to answer one more question, and that'll be it for this take. She asks, hello everyone. I know it's, I'm sorry. Does anyone get any dry itching feet? It's driving me crazy. What do you do on it? What's your best strategy? Well, itching feet, dry feet, and again, that has a spectrum to do with like the eczema that we get. A lot of lupus patients have dry patches or skin issues, and I always tell my patients, you know, whatever mysterious things that come up on the skin is probably a clear indicator that your gut is not right. And so if you have leaky gut, that permeability in our membranous gut lining, that's going to create a lot of toxin exposure. And usually when we have symptoms on our skin, that's the irritation from that. And you can probably bet that's the immune response to that specific toxin. So it's not an immediate innate immune response, which is supposed to be healthy. It's an acquired, prolonged, chronic immune response that becomes autoimmune over time. So that's what creates a lot of these unexplainable symptoms. So I hope that helps. For those dry patches, maybe rubbing your feet a lot and getting it to massage, and then doing some ankle pumps while on your back would be helpful. I'll try to incorporate some videos to kind of help with these kind of neurological symptoms, if you will. Thanks for joining me. I'll see you next time.